We are all connected through communication. If we communicate well, we can strengthen our relationships. Yet most people don't know that our non-verbal cues form an intrinsic part of how we communicate. A smile or a laugh is understood in any language and context. There are also many people who find it difficult to speak. They may have slight speech impediments or be completely unable to speak. But this does not mean that they cannot communicate through other means. There is a pervasive myth that people who are unable to speak have nothing to say. But our team at the Center for Augmentative and Alternative Communication in the Faculty of Humanities at the University of Pretoria has proved otherwise. The Center has conducted several studies in different contexts and designed methods and technology to help all people understand one another, whether you vocalize or use complex means to communicate your thoughts and feelings. A notable research project is being conducted with the University of Pretoria's Future Africa Institute and the United Nations Children's Fund, better known as UNICEF. Through this project, we are co-designing health communication and education materials to make information more accessible for those with complex communication needs, their families, as well as healthcare providers. Health information is often confusing, and the language used is difficult for people to understand. This is worse for people who have communication disabilities, and it affects their ability to manage their own well-being. People need to express themselves when accessing essential services, particularly health-related services. Both healthcare professionals and people with complex communication needs have to access relevant information, educate themselves about health issues, and communicate their needs appropriately. For people with disabilities, the right to access quality healthcare without discrimination is enshrined in Article 25 of the United Nations Charter on the Rights of Persons with Disabilities. Unfortunately, it is not a reality in many contexts, at least not yet. Our experience with the COVID-19 pandemic highlighted the situation. The need for easily accessible and reliable information was essential for people with disabilities. Those with complex communication needs had to find ways to access health information, teach themselves about the virus, and try to communicate with healthcare providers during consultations, often without the aid of their caregiver. Our center developed health education materials in collaboration with various stakeholders, including young people with disabilities, their caregivers, and professionals who work in the health and education sector. Using these findings, we co-designed a range of resources with people who have complex communication needs, their families, and healthcare providers. We disseminated these resources through various avenues and accompanied them with training workshops. The materials developed are freely available on our website. Our research improves the lives of people with complex communication needs and gives them the dignity, independence, and autonomy to make decisions for themselves. Human rights and disability rights matter, and the University of Pretoria is proud to make the research that we do today have an impact on the future.